This clip is brought to you by Merrick Health, the premium telehealth network from Derek More Plates, More Dates. Get your blood work and hormone optimization done under the same roof. Enjoy this clip.
What percentage of the population are they starting to estimate that is going to potentially run into Alzheimer's and dementia at this point? Like I've heard some staggering numbers. I don't know if you've heard.
Yeah. Well, today, if you make it to the age of 85, you have a 50% chance. So that's like a coin toss. Like you want to know your odds of developing Alzheimer's disease? It's a coin toss.
And this is U.S. only? Or
this is U.S. This is U.S.
Yeah, and I believe they've estimated by like 2030 be half the population by the age of 65.
Yeah. Yeah, what is it? I think today in the U.S. there's about 6 million people with Alzheimer's disease alone, and that number by the year 2050 is set to be triple that. So 6, 12, 18, yeah, 18 million people.
So there's something's happening.
Something in the environment.
Up.
Yeah, it's something in the environment. I mean, that could, the same could be said for cardiovascular disease rates. I mean, cancer, incidence.
Do you think they're all connected? Do you think, because there's some people that believe that heart disease, diabetes, and Alzheimer's are kind of all the same thing-ish?
Yeah. Well, it depends on who you ask and where you look, but generally, I mean, we know that we're becoming more insulin resistant as a society and more obese. Obesity is a huge problem, and if you are obese, your risk for developing certain cancers, for heart disease, for dementia, skyrockets, right? As opposed to somebody who is at a normal, healthy weight. And so, yeah, everything does seem to be connected, whether it's insulin resistance, but there are, with regard to dementia specifically, it's only as of the past couple of years that we've been able to talk about it as a potentially preventable condition. The 2020 Lancet Commission determined that there are about 12 modifiable risk factors for the development of dementia. And so modifiable risk factors are risk factors that fall under your control. And just to contrast that, you have non-modifiable risk factors. So non-modifiable risk factors would be, for example, your age, your gender. If you're a female, your risk is twice that of a male's. And your age, your genes, and your gender and your genes. So, and genes is one of these areas where, we're just sort of at the tip of the iceberg in terms of understanding all the different ways that genes play a role. But the most well-defined Alzheimer's risk gene is called the ApoE4 allele, and about 1 in 4 people carry it. And if you have that in the US, that puts you at anywhere between 2 and 14-fold increased risk. But then there's this concept of polygenic risk. So you have different genes that we have yet to describe that might, like in you cancel out the ApoE4 allele. So it's super complicated stuff.
Real quick question about that ApoE4 allele. Is that something that, like, if you did a 23andMe could pop up, or is it you need more specific testing for that?
No, that's actually very easy to figure out whether or not you carry that.
Okay.
But the recommendations that I make don't vary, don't really change depending on whether or not you carry that gene. I might make different recommendations, like in terms of dietary fats, because there's some thinking that ApoE4 carriers don't metabolize saturated fats as well.
Okay.
But in general, I think the modifiable risk factors are where we really have agency, and that's where I think most people should focus their efforts, not on what gene do I have, right?
Okay.
What do you think some of the most agreeable things, just in terms of our health? Like, what are things that are, I guess, the lowest hanging fruit that are modifiable, you think?
Yeah. Well, I think today, people they're eating too many what are called ultra processed foods. I think that's the big thing. Like when I first started, I was more interested in macronutrients and whether it was low carb or low fat that was more harmful. And then you can get granular with the plant-based versus the carnivore arguments, and are seed oils good, are seed oils bad? But I think ultimately the lowest hanging fruit is to just eat fewer ultra-processed foods and to focus your diet more on the minimally processed whole foods, like the foods that are around the perimeter of the supermarket. And I know people listening to this, your audience is incredibly savvy. They're like, well, that's not rocket science. But the reality is today, 60% of the calories that your average person is consuming, your average adult is consuming, come from these packaged processed convenience foods. And that number is even higher for children. For children, it's 70%.
Yeah, and
which is
imagine
insane.
if you could just change that percentage, whatever way you can.
Yeah.
In some small degree that you can, and then maybe over time you progress to improving it more and more over time.
Yeah, improving diet quality. Like diet quality, I think, is like a massive thing. Like the diets of most Americans are of such poor quality. And there are obviously like there are factors here that play a role that are outside of, that can be outside of people's control, like where they live, food access, and things like that, which is important. But generally, once somebody becomes aware of the fact that food quality is important, it also influences the amount of food that you eat, right? Like food quality plays a huge role in terms of like our drive to eat.
Yeah, if you were to change that 60% coming from processed food and turned it down to 50%, over time you'll be encouraged to eat less.
Yeah,
because you have better quality food. You can make an argument for protein leveraging, and maybe you're eating less calories, and over time you're eating less and less junk.
Yeah, absolutely. Like there was that Kevin Hall study, I believe it was 2018, that found that when people were given access only to an ultra-processed diet, they tended to consume a calorie surplus when eating to satiety, right, of about 500 additional calories. Whereas when it was like a crossover trial, when those people were given access only to a minimally processed food diet, they ended up eating at like a 300 calorie deficit. So right there, that's like an 800 calorie swing determined purely by the quality of the food that you're eating. So a lot of people, when they are on this like weight loss journey and they present to their doctors or their dietitians and they hear the advice like just eat less, move more, I think what they're not realizing is that what you're eating influences how much you're eating.
Yeah.
So yeah, that's I think like probably the lowest hanging fruit.
Hey guys, if you like this clip, go ahead and comment down below and let us know what you liked about it. All right. Share this with a friend. Make sure to subscribe to the channel. And also, we are on Reddit and Discord. All that's down below. All our sponsors and everyone that supports us down below there too. So you can get whatever you like from us. All right. Peace.